today. You are warmly welcome. This is Manifestation of Holiness. We meet here from Mondays to Fridays for our Midnight Raw, 12 a.m. US Eastern Time, by which time it will be 4 a.m. in Ghana and 5 a.m. in UK, 6 a.m. in Europe, and 7 a.m. in Lebanon. It will then be 1 a.m. in Japan. So kindly take note and join us as we pray. We also meet here Mondays, Thursdays, and Fridays for our Zion Hour, and the time is 12 p.m. US time. And so it goes like that. Beloved, I wouldn't want to take much of your time. Our topic for discussion today is suicide ideation in teenagers. It is getting rampant. And with me to do this today is a special person. He is in the person of Dr. John Attram. He is a senior lecturer and counselor at the University of Cape Coast, Ghana. He is licensed as a mental health counselor in Massachusetts, USA. And he is also a psychologist licensed with the Ghana Psychological Council, and also a member of the American Psychological Association. He is an expert in relationship as well as a marital counselor. So if you seek any advice on such issues, he is a go-to person that I would love to recommend you to. Dr. Attram owns a private practice, which is known as Attram's Consult, located in Cape Coast, Ghana. And so if you need any such help, like I said, you don't hesitate to contact Dr. Attram. Doctor, my audience can't wait to hear from you. First of all, I want to say a very big thank you for the warm reception. As I contacted you, you were so full of joy. You couldn't wait to come on the CS show. Here we are today. A warm welcome to you, Doc.
Thank you.
What should we expect?
We will talk a lot and ask questions a lot.
Right.
This evening, we are going to present on suicidal ideation in teenagers. Suicidal ideations are the thoughts to commit suicide. And to be able to do this well, we'll follow a certain outline. It will involve an introduction. We'll talk also about the prevalence of the phenomenon and the risk factors, the warning signs and symptoms. Then we look at the treatment options, and then I'll give a final thought and then allow for questions.
Right. Very good.
So we start with an introduction. Both adults and teenagers experience suicidal thoughts at one time or the other, but the symptoms and warning signs are different. Suicide is the second most common cause of death in young adults, and the incidence is rising, particularly among young men. Yet, most people who attempt suicide are ambivalent about killing themselves. That is, frequently what they seek is to stop an unbearable feeling or feelings, or a situation that seems frightening and intolerable. Someone who is suicidal may well be feeling trapped, hopeless, helpless, confused and distressed, and desperate to escape from his or her suffering rather than actually wanting to die. But at times like this, suicide can feel like the only way out. So in effect, when someone has the thought or the ideation for suicide, it is not because the person wants to die, but he is in a certain situation that he feels there's no help. He feels he has hit the wall and it's difficult for him to bounce back. And he cannot pass through the wall as well. So the only way out for this person is to commit suicide. Although studies suggest that the occurrence of suicide and attempted suicide in teenage populations is less than that of the actual larger population, the figures are still alarming and increasing. In the last 10 years, the total number of suicides has risen fourfold. Studies have indicated that young males were 4 times more likely to kill themselves than their female colleagues, and that young adults were another vulnerable group.
Right.
There are 2 types of suicidal ideations. Sometimes the pressures of life get too intense, and teenagers, like adults, decide to take their own lives. And mental health professionals look at suicidal ideation among teenagers to vary from just a fleeting passing thought to making actual plans to end their life. Hence, we have passive suicidal ideation and active suicidal ideation. These are the 2 types. Most people think about the idea for weeks or months before the actual act occurs, because it is fleeting and that one has to think about what they are going to leave behind. They have to think about whether it is the right choice or whether they should do it or not to do it. Right. And that is both passive and active. Okay. And so they think about it for weeks and months. So suicidal acts are rarely sudden. It's just not a sudden thing they do. They are rarely sudden. They are not even impulsive or random. Although sometimes we have tragic suicide epidemics where the attention that comes after one suicide leads other teenagers to try something similar.
Right.
So we look at the risk factors. Teenagers begin to consider acts of self-destruction for a variety of reasons. And we will look at some of them right now. But the major one is untreated depression.
Right.
But it's about ideations. Another risk factor is misuse of drugs, like substances like marijuana, cocaine, and other hard substances. Another risk factor is to escape from loneliness, hopelessness, academic or work difficulties, financial pressures or conflicts with other people. Or some people also have that ideation based on the loss of a loved one. Okay. And very funny enough, some people get this ideation to punish survivors who are likely to feel hurt or guilty. That is, the teenage in this state of mind will think of trying to hurt mom with killing himself, so that mom will feel guilty that I didn't train my child well, I didn't take good care of my child well, and then also feels hurt so that mom or dad will be hurting and grieving. Other risk factors are to manipulate others. We have people with personality disorders, and the main thing personality disorders present is manipulation. And some manipulations end in threats of suicide. And teenagers are very fond of that, manipulating people. If you don't give me a car, if you don't buy me a car on my birthday, kill myself. And it is like a threat. But like we'll learn later on, you don't take these threats very lightly. You have to act on it.
Right.
So they can manipulate you to buy them a car. And if you think it is a joke, they can kill themselves. Some teenagers also think about suicide so that they could join a loved one who has died. Somebody's girlfriend has died, and he said, I cannot stand it. I remember I attended a funeral of a colleague's daughter in Sweden, and then at the funeral, this young lady's brother was also grieving and saying that, this is my sister who has died. I will kill myself too. I will kill myself too. And people were thinking that, don't
it was a joke.
What are you doing? And then he killed himself.
Oh my God.
He killed himself. Some also have this ideation based on the fact that they think they can escape from some difficult situation. Or to punish oneself for something that has created guilt. Like there are examples of young men who have committed a crime, and that is that brings to them a feeling of guilt that they have disgraced their families or disgraced themselves, and it is not expected of them. So they will kill themselves. They feel like this thing that has happened, the only thing I could do to take my life away is to take my life. Another risk factor is to prevent oneself from becoming burden on others. Like a teenager may feel that after my national service, I should be working. And after national service, when his colleagues are working, and he's still depending on mom and dad, or maybe he feels it's a burden on mom and dad, he may kill himself. He may have the ideation to kill himself.
Right.
Others to have that ideation to avoid the suffering and other effects of some dreadful disease. I have had situations many times where teenagers contracted HIV and other diseases, and they felt that because of the stigma and the fear of death, they are going to commit suicide. There are also genetic factors for suicidal ideations. Genetic factors can play a role in suicide risk as well. Research has found that some teenagers who experience suicidal thoughts are often more likely to have a family member who has died out of suicide. And so that ideation is there. We say behavior is learned through observation and modeling. So if what the family member model was suicide, a teenager may also tend to emulate it.
Right.
Some of these factors are very illogical, yet they happen. For example, it is no guarantee that committing suicide will enable a victim to meet his loved one who has died. Again, if it is for gaining attention, the victim will not be present to enjoy that attention. You are dead, so you will not enjoy the attention you were seeking in the first place.
Right.
So it is illogical. It doesn't make sense. So what are the warning signs? Teenagers show many signs they are experiencing when they have suicidal thoughts. And these include, first, they become extremely agitated. And these are things we must all watch out for critically when we have teenagers in our homes. They become extremely agitated, upset, depressed, and anxious. Depressed teenagers report physical aches and pains. You see, ordinary depression may not give you physical aches and pains, but in teenagers who have these thoughts, they report of physical aches and pain, even though laboratory tests would show that there's no there's no pain or ache. It will reveal, the laboratory tests won't reveal any findings. They may begin to use frequently alcohol and hard drugs. They frequently use drugs and alcohol. Some teenagers having suicidal thoughts experience a sharp decline in their academic performance. However, there are some too who maintain good grades, especially those in the universities. You recognize that their grades will begin to go up in spite of their emotional problems. Some express hopelessness or feel they have been trapped with no way out. Some have mood swings, extreme mood swings. They frequently talk about death or dying. They begin to give out their possessions to their friends and other people for no good reason. They isolate themselves and withdraw from social contact. They begin to look for and acquire means of committing suicide, means to commit suicide, like looking for arms and ammunition, cutlery, getting a gun, or finding a lot of medications and other poisonous materials with which they can carry out the act. Some also make a point to say goodbye to people, saying things like, I wish I were dead. I wish I had not been born. So if you have a teenager in your family who will be saying, I wish I were dead, I wish I had never been born, then he's trying to give you a hint. And these warning signs are very clear. These signs may differ from teenager to teenager, and some of them keep these thoughts and feelings to themselves. That is the most dangerous part of it. Some will voice out or act out these signs, but unfortunately, some too would keep these feelings to themselves. So parents, teachers, pastors, and friends must be alert when their loved one is not acting as usual as themselves, and try to consult a doctor immediately. Now, let's look at treatment. Treatment for teenage depression and reducing suicidal thoughts may include counseling or psychotherapy, medication, or a combination of both. In all cases, parents must be involved in their child's treatment. It is common for depressed teenagers to refuse help, so parents may see a mental health professional themselves in order that they will gain insight into their child's problem in order to provide the needed support on their own. Parents must provide support for their child. They must remove all arms and forms of cutlery from the common area and kitchen. They must also remove medications, drugs, and alcohol from the common area. They should look for signs and symptoms of depression and changes in personality. Now, with all this in mind, what do I, as a psychologist, say? Thoughts about suicide are very common. The thought will probably cross the mind of a majority of teenagers at some point in their lives. Approximately 5% of those who go to counseling, that is approximately 40 to 50 students in a year, talk seriously about suicidal ideation.
Right.
So if you come across a student or a teenager who has such a problem, the first thing you do is to ask. Ask if that person feels suicidal. Asking that person is very unlikely to put the idea into their head, and they may feel relieved to talk. The second thing you do is to listen. Take the teenager and what he or she says very seriously, and try to understand their perspective of the situation. The teenager may be able to tell you that they need something or they need help in a certain way. Discuss and try to discover what might make a difference without imposing your own solutions on the problem. Many people, many adults think they have solutions to these teenage problems.
Yes.
Don't impose your solution. Yes. That is why I love counseling, because in counseling, you are neither judgmental or intrusive. Allow the person to discuss with you so that you know what is actually going on, instead of listening just a little and trying to proffer solutions that you don't know much about.
Right.
You know, in order to get all these things done well, you must begin to offer practical help towards problem solving. For example, lifting an academic deadline for him so that he will be able to finish his academic work, or trying to take him to where the stress is coming from so that you on your own will be able to support the teenager. So you must practically seek to support the client in any way that will make him get relief. Don't overreach your own limits of time or expertise, or promise something that you can't deliver. A person who is suicidal does not need any more disappointments. Don't go and tell him something that in the long run you will not be able to do. If you do that, the next 1 hour you commit suicide on your own. Then, if all these are done and still there's a problem, what you need is to refer. Do not take a sole responsibility for the situation. Sensitively indicate that you are concerned enough to arrange for further help, even if it means breaking a confidence. So, ladies and gentlemen, we have looked at suicide to some extent, but the rest remains with us, with our experiences and with our thoughts. It's time for questions, if there are any. Thank you very much.
Thank you so much, wonderful people. This is the CS show. If you just joined us, we are discussing the topic suicidal ideation in teenagers. Why do these young people want to indulge in such an act? Whether we like it or not, it is ongoing. And Dr. Attram, who is a mental health counselor, just did justice to the topic. He took us through what, the topic is, what are some of the risk factors he told us, and then, the treatments that we can give to curb this problem. And so if you have any questions, do not hesitate to, unmute yourself and then put them across. If you also have any contributions, any other concerns, you are so welcome to do so. The CS Show is a proud initiative by Prophetess Rhoda Anna of Manifestation of Holiness. My name is Paulina Amankwa and I am your host. At this point, if you have any questions, yes, I see Mrs. Tete's hand up. Mrs. Tete, please unmute yourself and put your submission across.
Hello, good evening.
Good evening.
Yes, thank you so very much, Doctor, for the, the light, the illumination we are getting tonight. I just want to ask, for instance, your teenager has committed the suicide already. would you beat yourself? Would you continue grieving for you to get into maybe something else? Because when these things happen, some people beat themselves so hard that they call like different sicknesses upon themselves. And I mean, the suicide has already happened. And then so in fact, the family runs from one sickness or from one problem to another problem just because one child has committed suicide. I just want to ask if it is okay to be thinking about it, to be beating yourself, to be regretting that maybe you did not do it right, and then you call problems upon yourself. I'm just asking.
Yes, this will call for a grief therapy.
Mm-hmm.
You know, grieving move in stages. Whether to beat yourself up or not depends on how you grieve.
Right.
Many people have been in very painful situations and they did not know how to grieve. And so for years, they will be grieving. It is a process. First of all, the moment you get to know of this suicidal situation, that is, the act has been committed already, it presents you with shock. Shock. You will be shocked that your child has committed suicide. After the shock, you move on to anger. Anger. You become very angry that this should happen. Yeah. Some people even get angry with God. You see, some people even get angry with God. Yeah. Then after the anger, you enter into denial. Denial. Oh, no, this cannot happen. This isn't happening. How can such a thing happen? They enter into denial. Then from the denial, they go into guilt. I should have done something. If I had done something, it would have helped my child not to have committed suicide. Something like, if I had taken into consideration the risk factors and have watched out for the warning signs, my son or daughter would not have committed suicide. Then from the guilt, the parent himself or herself will enter into depression, which at that time, if care is not taken, the parent or the loved one or one of the siblings will also want to commit suicide. Right. So it is at what stage would you be able to get help yourself? So what I will say to this question is that as soon as this incident happens, the parents must seek therapy. We have grief therapy, and it will help them go through the process successfully. Let me tell you something. I've seen somebody who has lost a son through accident, and they grieved for 3 years. Why should that be? It happened that they could not resolve their grief. So if you enter into the phase of unresolved grief, you will gain some mental illness. Depression is one, and then you begin to see things. That is, you become delusional, and you may even tend to kill yourself, commit suicide yourself. So it's important that you take note of this and not beat yourself up. You must seek help yourself. Though this thing has come and it is gone, the pain is still with you. And without help, the pain will not go. And unfortunately, if the pain doesn't go, the parent themselves will commit suicide, or one of the siblings may commit suicide out of the grief.
Thank you very much, Dr. Attram. I want to believe that Mrs. Tete is satisfied with the response to her question.
Very
And,
satisfied. Thank you.
very good.
Mrs. Tete, are you okay with the answer?
Yes, sir. Yes, sir. But I
Yes.
just want to ask one more question.
Go ahead.
Yeah. Do you reckon, from time to time, maybe your children are good, but do you reckon from time to time, teenagers are taken to a psychologist just for a chit chat to see what's in their mind and what's cooking in their mind, kind of? Or it's not necessary?
It is very important. In fact, when I was in the United States, what I do with families is that it becomes part of their annual physicals, so that when they go for the annual physicals of physical and physiological situations, it is added by their physician to see a psychologist. And then when they come, we do some psychological assessments. We go through stress assessment, anxiety assessment, depression assessment, to see if everything is okay. Because there are so many mental health situations where the outsider, as it were, who does not have that eye or the ears, would not be able to recognize that somebody is going through pain or some mental illness. So it's important that children are sent to a psychologist once a year. Yeah, once a year will be okay. Or if there is a genetic problem, you see, I mentioned genetic factors. If there is a genetic problem, then of mental illness, then every 6 months, they should see their psychologist for assessment to alleviate any impending situation.
Thank you. Thank you.
Welcome, Sister T.
Thank you so much, Dr. Attram. So I would want to pose this question. Let's say you have two different teenagers at home. One is very extrovert. One is the extrovert type, and the other, introvert. And so, this other one is able to tell how he or she feels, and the other one is almost always so quiet and want to keep things to himself. Would you say that the likelihood that the one who is very quiet to commit suicide is on the higher side as compared to, the other one who is extrovert?
It will surprise you to know that that extrovert may be suicidal more than the introvert. You see, extroversion and introversion are both natural dispositions. The most important thing about these two situations is about parenting. You see, parenting must include mentorship and coaching, and also instruction and education, so that at every moment, mommy will let children know what to do and what not to do. And the home must be a very conducive place for discussion and proper communication, so that children at home will feel free to open their mouth to say anything they want to say to mom and dad, so that mom and dad will be able to help. I can go very deep into this because it's an area that causes a lot of discomfort. We have what we call a genetic disposition. So an experienced psychologist will do a genogram even before marriage, a genogram of both mother and father. There are individuals, I know of somebody who was a Christian-like. He was a pastor, and suddenly he started smoking marijuana and drinking hard alcohol. And then when he was brought to me and we went through psychotherapy, at a certain point, I wanted to do a genogram and found out that this thing is emanating from his grandfather, on his mother's side, grandfather, who was a first-class alcoholic and drug user. And what is there is that he is predisposed. We are all predisposed to certain situations based on our genetic factors. And why we don't do them is that nothing has happened to trigger the situation. So this pastor faced a certain marital issue and he could not solve it. And so it triggered the mental health problem that was in him. And since he has no skill to get over the mental illness, he took to what is in his blood, that is alcohol and marijuana use. So it is important that we look out for these situations, whether our children are you see, these dispositions, that is extrovertism and extroversion and introversion, are just one part of the person's character. Just one part. There are so many other ones. So an extrovert may hide suicidal ideations, whilst an introvert may readily come out and say what, depending on what mom and dad have trained them to communicate in the house.
Thank you very much, Doctor. I also want to find out, can one easily conclude that, for instance, a child has no reason for wanting to attempt suicide because I am doing everything humanly possible, or I am doing everything possible? I mean, I take you to church, I talk to you, I give you all the attention that you need. And, you know, it looks like I have done all that there is, you know, as a parent to do for a child. But this child simply, you know, would not open up to me for me to know exactly what is going on with him or her. Can I simply conclude then that he or she has no reason to attempt suicide?
Yes, he has no reason from a physical point of view, but he may have reason from a psychological point of view. You see, it's like we were talking, we said that a teenager may commit suicide and then trigger a chain reaction of suicide episodes in his circle. Mom does everything for the child, goes to church, talks to them, everything, and so on and so forth. And he goes to school. And one of the brightest students, one of the outgoing students, one of the most friendly students in his class commits suicide. Like peer pressure, it creates a chain reaction. Another person will try to do it. You see? And this your son may be unlucky to be that type whose risk factor is that I want to commit suicide so that I can meet my friend who has committed suicide. So the most important thing we do here is to be alert and try as much as possible to talk to our children, even if they don't want to talk to us. Talk to them every time. Invite other people into your home, like pastors, like teachers, like psychologists. Let them have lunch with you. Have friendly discussions. Let them open up to these people, and then you'll be safe.
Thank you so much, wonderful people. So we are on the SEER show, and if you are just joining us, the topic for discussion is suicidal ideation in teenagers. If you have a teenager at home, if you know he or she is related to you and you don't see things very right with him or her, then today's topic is the right one for you. Mrs. Tete's hand is up again. Please unmute yourself and go ahead.
So, Dr. John Attram, you made mention that teenagers should have a chit chat with the psychologists once a year. that once a year, is it just a visit, or there might be sessions that the children will go through? Or it's just,
Okay. I wouldn't call it chit chat.
yeah,
You see,
okay.
I think you are in the United States, right?
No, I'm in Kuwait.
Kuwait. I think every year your children go for annual physicals with their doctor.
Yeah.
Where they look at their dentals, their physical being, and so on and so forth. Unfortunately, many people do not add psychological assessments. And so I am suggesting that from now on, in addition to the annual physical, that is physiological test, annual physiological test, and annual dental, and so on and so forth, you must add psychological assessments so that the psychologist, it's not ordinary chit chat, he will do an assessment, a deeper assessment, to find if the person is prone to any mental health problem, and then we'll start seeing it.
Okay.
If there is any sign of a mental health issue, that will trigger various sessions of psychological visits, you see. So, but if there is nothing like that, the first assessment will show it, prove that the child is okay, and then that's it. So if you go and the psychologist is telling you that I suspect some phobias in your child, or I suspect some anxiety in your child, I can just look at somebody's face and tell them that that person is experiencing fear. In my practice, I don't just mention shyness like that. No, shyness is a sign of so many mental problems. So if you have a child, I go to so many homes and mothers that, hey, as for this, my child, he's shy, and they are proud saying it. My son is very shy. No, he has a problem. Why is he shy? Why is he not able to make eye contact with somebody? You see, so during the assessment, then it will trigger something, and then we begin to see the child on maybe a weekly basis, fortnight basis, or monthly basis, until that psychological problem is gone away.
Thank you.
Wow,
You're welcome.
This is a big eye opener. Wonderful people. We cannot just be with our kids at home and think that all is well. The earlier we take the steps to curb this issue, the better. And so let's take care of this issue before it gets out of hand. So Dr. Attram is also a relationship expert and a marital counselor. And so if you need any advice concerning your relationship issues, your marriage, then I would want to urge you, I would want to recommend him to you. Contact me and then you will get in touch with him. This is the Seers Show, a proud initiative by Prophetess Rhoda Anna of Manifestation of Holiness. My name is Paulina. You can call me Lina. I am the host for the show. And my guest for today, our guest for today is in the person of Dr. John Attram. Dr. John Attram. And so the topic for discussion for today is suicidal ideation in teenagers. Beloved, if you have any questions, you are free to do so. We still have some few more minutes. So if you want to put anything across, you are so much welcome to do that. So doctor, before anybody comes in with any questions or concerns, I don't know if you have any final tips for us. We'll be grateful.
All right. One important tip I would like to pass on to members is that fear is a problem. Fear is a problem. I'm not talking about ordinary fear, that I fear this person, I fear this dog, I fear this darkness. I'm talking about clinical fear. If you contact me, I I will send you a copy of my book. It's also on the American Library of Congress, Library of Congress. My book is on Amazon. It is called Too Scared of Tomorrow, a clinical approach to understand fear. It talks about fear. One thing about fear is that fear is an emotion. It is a feeling. And those who experience fear may not understand it, may not even know it. And for that matter, they will not be able to own it. As a result of that, I tend to explain fear, that it is that which brings somebody back in life. That is, people face rejection and abandonment in marriage, in their homes, in churches, in class, and so on and so forth. People are rejected and abandoned. And what they look for is acceptance. When this acceptance is not coming, they begin to exhibit fear. They experience fear, clinical fear. And because fear itself is a primary emotion, it does not manifest itself just on the go, but rather fear uses certain secondary emotions to manifest itself, like anger, like confusion, like vulnerability, like guilt, like shame, like doubt, like worthlessness. All these are secondary emotions, and they are hidden in us. So what they do are these secondary emotions, they are that which trigger various mental health issues. Many mental health diseases are caused by these secondary emotions. Somebody is depressed, and it is as a result of that person facing a kind of fear from abandonment,
Right,
or rejection. For example, a baby, even a baby, will be able to encounter fear in a clinical sphere. That is, if mommy abandons a baby, the mom has instilled mistrust in the child, and the child will refuse to trust anybody. Even if a relative comes, wants to pick it up, it won't allow. It will start crying.
right.
Their only language is to cry. So if you have a child and the child cries and you don't attend to them, today I am telling you that you are rejecting that child. You are abandoning that child. And it will take very long time before this situation can be resolved.
Right.
If you see a child and you look at the child with disdain, the child will see it, and it will affect the child's soul, and it will live with the child until the child seeks psychological help. So this issue of depression and suicide and the rest are all as a result of fear. But because fear is hidden and you cannot see it, it is important that we make regular checks psychologically.
It is definitely important that we make regular clinical checks psychologically so that we don't end up miserable. Wonderful people. This is the CS show. I don't know if anybody has any questions anymore. If you do, we still have some time. Doctor is here to help us through. Is there anybody with a question? Any concerns? You have personal issues you want to contact doctor? Feel free to get in touch with me. My name is Lena. If you happen to be on our WhatsApp platform, you will get my number over there. Otherwise, I am also leaving it in the chat section. Get in touch and you will get connected to doctor. Okay, so if there are no questions, if there are no concerns, then Ebenezer, this is how far God has brought us. We want to thank God so much. And I also want to say a very big thank you to you, Dr. Attram. You have been amazing. And you are definitely coming on this program again. I have listened to you on your topic, anger management, and I can't wait for you to deliver it to my people. It helped me so much. So we would want to have you. So wonderful people, all too soon. This is how far we will come. Same time next week, we'll come your way with a CS show.
Okay, bye-bye.
Bye-bye. I love you so much. Take very
Bye-bye.
good care of yourself.
Bye,
Bye.
bye,
Thank
bye.
you.
And stay blessed.
Thank you, Dr.
Bye.
John.
Bye.
Thanks so much.